Hi, this is Dr. Dave Scardella from Center for Progressive Dentistry in Duxbury, Massachusetts. During this quick dental consult, I wanted to go over the differences, advantages, and disadvantages between dental implants and dental bridges. This very simple cartoon summarizes the major differences between dental implants and a dental bridge. On the left, the dental bridge you can see is retained by the adjacent teeth, where on the right, the dental implant stands alone and is not connected to those adjacent teeth. Both options are fixed, meaning they're cemented or screwed in, and they cannot be removed by the patient. Let's talk about dental bridges first. As you can see in the top photo there, the teeth on either side of the space have been prepared. It's basically like it's being prepared for any other crown, and then the bridge slides on and is cemented onto those anchor teeth as one unit. And even though it looks like three separate teeth in the mouth, they are actually all connected. This is a step-by-step diagram of how we make a dental bridge. There's a missing tooth in the middle. Those teeth are then prepared, and in this diagram in the upper right, that's a pretty aggressive preparation of those teeth, but it shows the point that they do need to be modified. And then the bridge is placed over those two anchor teeth, and the final result, it looks very aesthetic, very nice. You really can't tell the difference. You can't tell which tooth is the missing tooth. So there are some pros and cons to bridges. I think the main pro is that there's really a shorter treatment time. If the tooth is already missing, it's just a 2 to 3 week turnaround time and two appointments. If the tooth still needs to be extracted and then the bridge needs to be done, well, that adds about 6 weeks of healing time. Insurance reimbursement may be better for bridges, at least traditionally. Now more insurance plans are starting to cover dental implants. And it can be more efficient if the adjacent teeth are already in need of crowns. So if the teeth on either side of the space already need crowns, it can be very efficient to just place a dental bridge. Although I don't think that makes it better treatment. I think the ideal treatment in that situation would be individual crowns on the adjacent teeth and a dental implant in the middle. The cons are that you do need to repair or cut down adjacent teeth. If the adjacent teeth have existing crowns that are in good shape, those need to be removed. Another disadvantage is they are much more difficult to clean. You can't floss between your bridge, and they do make special flossing instruments that go under the bridge, but we find that because they're more difficult, patients tend not to use them. And then if one of those anchor teeth gets decay, well, you have a failure of the entire bridge. The whole thing usually needs to be replaced. So it's basically a 3-tooth solution for a 1-tooth problem. Let's talk about dental implants next. There's 3 components: the dental implant, the abutment, and the crown. The dental implant goes into the bone. It's underneath the gums. The abutment serves as the connector between the dental implant and the crown, which is above the gums. There are some pros and cons to the dental implant. The pros, mainly it's a 1-tooth solution for a 1-tooth problem. We don't have to cut down any adjacent teeth on either side. You're missing 1 tooth, or 1 tooth needs to be taken out, and we can replace that 1 tooth with a dental implant. Dental implants are also easier to clean because they are separate from the adjacent teeth. You can floss between them. The dental implant is made of titanium and ceramic, and they cannot get decay, so you won't get a cavity on your dental implant. And for a single tooth in our office, if the adjacent teeth are in good shape, a dental implant is actually less expensive than a dental bridge. The main cons is that it's a longer treatment time. It's about 2 to 4 months on average. However, if the tooth needs to be extracted and then we have to wait for healing time, that can add 3 to 4 months for the process. So you're looking at a total of around 6 months before you have that tooth. Also, not all patients are candidates for dental implants depending on their medical health or the amount of available bone that they have. So I just wanted to go over a few quick cases of my own. This patient was missing a front tooth. The adjacent teeth had veneers. We didn't want to cut off those veneers, even though there was a little bit of recession on the adjacent teeth. So we put in a dental implant. This is that abutment that we were talking about. In this case, it is made of titanium and it's gold colored. And then the dental implant crown is put on just like any other crown over the abutment. In this case, the patient was missing multiple teeth, and he also actually needed multiple crowns. So even though we were crowning adjacent teeth, we chose to do dental implants to replace the missing ones so that we could keep everything separate as separate units, so the patient would have a much easier time cleaning them, and I think that would lead to a longer lasting result. This is a young man who had one of his front teeth knocked out playing basketball, and we were able to replace that with a dental implant. And the last case is a patient who broke his left front tooth. If you look in the left photo there, you can see a sliver of his front tooth there. And in the right photo, in the after, we actually did a crown on one tooth and a dental implant on the other. And you really can't tell which is the fake tooth that's missing and which is the regular crown tooth. So I hope that dental consult gave you a little insight into the differences, advantages, disadvantages of dental implants and dental bridges. In my own personal experience and professional opinion, whenever possible, I try to do a dental implant rather than a dental bridge. I think most dentists at this point in 2018 think along the same lines. So if you had any questions and you want to schedule a free dental implant consultation, give us a call at 781-934-9444. Thanks a lot.